Hello, Assalamu alaikum. I am SADAM ishaq from GMM 28 4th semester. Today, my topic of short discussion is gout and anti-gout drugs. As we all know that risk of gout increases when uric acid level increases our body, or a condition that is called hyperuricemia. Actually, hyperuricemia is a condition in which our uric acid level increases more than 7 milligram per deciliter in our body. As uric acid level increases more than 7 milligram per deciliter, it makes our body fluids like synovial fluid saturated, and that causes the formation of the urate crystals in the synovial cavity. That definitely causes gout. So, as in our basic chemistry classes, we have studied a concept that a solution or a water only allows specific amount of salt in it to get dissolved, but after that, after a specific limit, a salt instead of dissolving in the water, it starts lying down at the bottom. So same phenomena reveals the concept of our body fluids also. The crystals mainly affect the joints of fingers, elbows, toes, and knees. Due to the, as we see that such patients are more common in the, or the severity of the gout increases in the winter season. That is due to the low temperature of the synovial fluid, and the dissolution of urate crystals decreases, and formation of or crystallization process starts. That causes inflammation, pain, and deformed joints. Deformed joints is like a gout tophy. Gout tophy is such a condition in which urate crystals around the joints forms, and also forms on the surface of skin, and it also increases the risk of the formation of urate stones in the kidney, as we can see here. So once inside the joints, phagocyte attack to break the urate crystals, and during their attack, the phagocyte releases the hydrogen ions. Actually, it worsens the condition that they release hydrogen ions, because hydrogen ions attaches with the urate anions, as we can see in the picture, and forms Ha unionized form of crystals, and Ha, that is unionized crystal, is less soluble in aqueous solution, and can easily form crystals. So a question arises here, that from where the uric acid comes. So let's talk about that. About 80% of our uric acid comes from the breakdown of the purines. So purines are actually nitrogen bases like adenine and guanine, and that are used in the buildup of the RNA and DNA. So when a cell dies, these purines must be disposed of. So our body converts these purines into the uric acid by a process. Here we can see that purines first convert into the hypoxanthine and xanthine and then into the uric acid. So this this conversion of the purine into the uric acid is carried out by the enzyme that is called xanthine oxidase. This process of conversion of the purines to the uric acid is mainly carried out by liver. In this way, it contributes to roughly 80% of our body uric acid formation. After that, 20% of our uric acid comes from our diet, or a diet which contains more purines in it. That includes fish, oily fish, red meat, alcohol, and beans. So, the summary of hyperuricemia, causes and risk factors for gout. Mainly, the causes of hyperuricemia includes enzyme defects that results in the overproduction of the uric acid, and secondly, diet, that is the overconsumption of the purines that converts into the after uric acid, and third is the renal failure that leads to the decreased in the uric acid excretion, and the fourth is cancer patient. In cancer patient, it is due to the chemotherapy and radiotherapy that causes the cell death, and after that purines converted into the uric acid. In this way, they contribute into the increase of uric acid level in our body. So fifth is diabetes and obesity, that also increase the gout risk due to the acidic environment there. So let's discuss about the treatment. As we all know that we do treatment that is symptomatic and etiologic. In symptomatic treatment of the symptomatic signs and symptoms of gout patients, that mostly comes to us are inflammation and pain, and that are the signs and symptoms of the gout patient. So we have to deal with them. And other is a etiologic treatment that is used to lower the uric acid level in our body to prevent the gout attack. So in symptomatic treatment of gout, we give NSAIDs, that are non-steroid anti-inflammatory drugs. In non-steroidal anti-inflammatory drugs, we usually use indomethacin and naproxen, that reduces the prostaglandin associated with the gout and pain and inflammation. Colchicine is also a drug that is used in the as an NSAID in the treatment of symptomatic treatment of gout, but it is used as the second line treatment of acute attack. So its function is that it inhibits the phagocytosis. As phagocytosis inhibits, the hydrogen release will definitely stop. That leads to the not the formation of urate crystals. And other is that it inhibits the leukocyte migration to the joints. So these actions decreases the release of hydrogen ions, and that prevents the urate crystals formation, and definitely that gives anti-inflammatory effect. As far as etiologic treatment concerns, first we use hypouremic agents. We commonly used allopurinol and febuxostate. These drugs are actually used to inhibit the function of xanthine oxidase enzyme that is main agent in the formation of the uric acid from purines. So these agents, allopurinol and febuxostate, stops the formation of uric acid basically, and it prevents the formation of uric acid. Another category we use in the etiologic treatment is the uricose-uric agents that includes probenecid and sulfenpyrazone. These drugs actually inhibits the urate reabsorption from the kidney. As we can see here that in the proximal tubules of the nephron, urate is reabsorbed back into the blood through a special transporters there. These drugs that includes probenecid and sulfenpyrazone that are uricose-uric agents blocks these transporters as they block the transfer or reabsorption of urate crystals will not occur. So in this way urate crystals reabsorption stopped. So thank you so much for your attention, and I'm especially thankful to the Sir Abdullah for providing me an opportunity to give this presentation, and thanks to all of you too. Thank you.